Childhood obesity is a growing epidemic in the United States, and it is affecting about 1 in 5 children nationwide.
I mean, the statistics are just staggering. According to the CDC, it's one of the most significant pediatric health issues in the tri-state area. Joining us now is Dr. Michael Ronan, a dad. He's a pediatrician at Pro Healthcare with more insight into the problem and how we can fix it. First off, how significant is the problem?
So, as you said, it's a growing problem. About 40% of U.S. adults are obese, and about somewhere between 17 and 18% of U.S. children are considered obese at this time.
And we were saying that the problem is getting worse. Why do you think that is?
You know, there are a lot of different issues that factor into it, but John had mentioned that, you know, one of it is that people are just not making really, really good, healthy food choices for themselves. So, so one of the things that we encourage people to do in my practice and everywhere in pediatrics is we want to make sure that people are working with us on a regular basis on this issue.
What does that mean, working with you? Are you helping, you just educating people to make better food choices?
So that's part of it. So education is part of what we do. We're having people come in, so when we see a child for their checkups or when they come in and they're having this issue, one of the things that we encourage them to do is to keep coming to see us on a regular basis, because this issue, as anybody who's tried to ever fix their weight knows, it's a complicated, long-term thing. There's no quick fix. There's no easy answer to it. So we like to make sure that children are coming on a regular basis to see us, to talk about the choices they're making, to talk about the plan, to work with us, to receive encouragement on the plan, to receive, you know, feedback for them to not get discouraged, and most importantly, to just stick with it when they decide to try to fix this.
And also to find out if the weight gain has something that's not diet related.
Yes, so that's an important thing to do. So the first thing we always do is we want to make sure that there aren't any organic causes, nothing medical. So for children of all ages, something like hypothyroidism is a concern. For older children, especially girls, something like polycystic ovarian syndrome. Those are two things that are medical causes for weight gain, that the fix would not just be simply changing your diet. There are other things that you need to do to correct that.
Aren't you walking through a minefield, though? Everybody's so sensitive about their weight. Parents are. What do I do if I suspect that my child is obese? And it's such a label. I mean, the label has issues, too.
Yeah, the label has issues. I mean, what I always try to do is present it as, look, this is, you know, your weight is going, typically what I'll tell people is your weight is going up too fast. And that can lead to problems with your health in the future. And you're a growing child, or your child is still growing, and this is the time to work on these issues so that we can avoid health problems in the future, so we can keep you healthy. I always present it as a matter of, look, this is something that's part of your health. It's important. So we're going to work on this together and make this that, you know, this is something we're going to work on for your health.
What are some other tips? I mean, the first one was to get to your doctor and get a baseline on what's happening with, you know, your body. What are some other things you want parents to know?
So other things, it's important to be in communication with your doctor, to ask questions. Then we generally recommend telling people about making healthy food choices. So in general, avoiding low nutrition, high calorie foods, trying to avoid sugary sweetened drinks, trying to avoid, you know, unhealthy eating habits, patterns, those kinds of things. But also making sure that you get regular exercise, which is important for your health. Doesn't, unfortunately, contribute so much to your weight unless you also change your eating habits. But those are the types of things that we talk about at those visits.
Of course, the reality is the processed sugary food is the cheap food, so it does get into a socioeconomic issue as well.
There is definitely a part of that that is due to that, you know, people in certain socioeconomic situations have much easier access to sort of lower nutrition, higher calorie foods. But this issue is facing people across the board, across socioeconomic you know, ranges. It doesn't really discriminate.
Well, it's important work what you're doing.
Doctor, thank you so much for being here and for the tips.
Thank you so much for having me.
We're going to have more tips for developing healthy habits on our website, cbsnewyork.com.